I'm pleased to be joined on Health Beat by Dr. Kinzie Norris, board-certified breast surgical oncologist with Faith Regional Physician Services Breast Care Clinic in Norfolk. And as a fellowship-trained breast surgeon, you're able to offer patients several surgical treatment options. If you would, explain the surgical options for breast patients right here in Norfolk at Faith Regional.
Certainly, Rob. Well, as you know, no one wants to be diagnosed with breast cancer.
Sure.
But it's important for women to know that just because they've been diagnosed with breast cancer, it doesn't necessarily mean they need to lose their breast. There have actually been many advancements in the last 25 years or so for the surgical treatment of the breast. And many women who have regular screening mammography actually are diagnosed at a very early stage, and therefore they have several options for their treatment. First thing that a woman may need to know is that she can have something called a lumpectomy. And a lumpectomy is actually where we take only the cancer out with a little bit of normal tissue surrounding the tumor. Now, normally this will not cause any sort of divot or deformity of the breast, and she just will have a little scar from the actual surgery. We can even consult the plastic surgeon at the same time to actually have them do even a breast lift or reduction to make the breasts actually appear better than when we first started. So that's often what women really like, even though they're going through this diagnosis.
Sure.
Now, if a woman does choose to have a mastectomy, which is the removal of the breast, or she needs a mastectomy, there are even several options with that. We can do something called a skin-sparing mastectomy, where we save most of the skin of the breast and therefore can reconstruct a new breast at the same time. And this again is done with myself and one of the plastic surgeons during one surgery. A new advancement, or the most new surgery in breast surgery, is something called the nipple-sparing mastectomy. And what that means is we actually leave the entire envelope of the breast, the nipple, areola, and all of the skin, and take out the breast, the entire breast, through a small incision. In that case, sometimes the scar isn't even visible after surgery, or it just looks like the woman had a normal reduction and lift. So those are some of the new advancements that we have as far as the breast portion of the surgeries. Now, as far as lymph node surgery, in the past, women were kind of forced to have an axillary lymph node dissection, which means we take all of the lymph nodes from the armpit to see if the breast cancer had spread. In fact, now we do something called a sentinel node biopsy, where it's much less of a surgery and has a less risk of complications.
Well, that's a lot of information, great information, and all available at Faith Regional.
That's right.
Great, thank you so much.
Thank you.
To learn more about clinic locations, specialties, and providers, visit frpsclinics.org.